Well, good afternoon. Lee Harris, Mayor of Shelby County, really pleased to be here on behalf of the Joint Task Force. We have other speakers this afternoon and have opportunities for question and answer. Before we get to that, I wanted to remind and encourage everyone to mask up. Mask helps us to slow the spread and helps to reduce the number of respiratory droplets that are transmitted from one individual to another. We have been working on a masking up campaign for a very long time, but have a lot more work to do. In fact, we have the data to prove it. And so right now, I'm just sharing some preliminary data from before the health directive went in place. And what this data tends to show, in my view, is that the health directive was absolutely needed, and that we have to encourage more of our community to mask up. So the first number you see on the screen right now is our mask usage based on observational study before the health directive took place. This was an observational study done by the health department in collaboration with the University of Memphis, and the study took place between June 15th and June 21st. And at that time, we had about 51% of our population overall using a mask or observed using a mask. So clearly, during this period, we have a whole lot more work to do. We also did some observation around mask usage by age group, and so you can see that on the next slide. And so before the health directive, we have a lot of work to get our young residents to wear a mask. They were the lowest users of masks during the time of this observational study, and the highest usage was among our older residents. So I say to young folks, come on. We need y'all to use masks and help us by doing this very, very simple, straightforward thing that will help us to reduce the spread. The observational study also includes data around mask use by demographics. And as you can see, our Latinx population has among the lowest mask use at the start of this study. We expect the students who led this effort at the University of Memphis to join us here at the podium real soon to talk about these findings and talk about how mask usage has evolved over time, given the campaign to encourage people to use masks, and also given the City of Memphis ordinance and the health directive. Suffice it to say, we need young people to use masks more often. We need our diverse communities to use masks more often. And we also need to see mask use throughout our community. There's one more stat, by the way, and this is the stat around what mask usage is like in high transmission areas versus low transmission areas. And as you can see, this gives some signal, right, that mask usage might have a real significant role in reducing transmission, because mask usage is higher in low transmission areas, and it is lower, mask usage is higher in low transmission areas, and mask usage is lower in high transmission areas. And so that's correlation, not necessarily causation, but we think that mask usage will help to reduce the spread, and all evidence and all indicators suggest that that is right. Let me make my second announcement here. I want to shout out our 20 summer fellows here in Shelby County government. These are the young adults that we hired this year to work over the summer, specifically on COVID response and to learn more about public health. They have been working for Shelby County government for the last 6 weeks, providing contact tracing support in our county's health department. They've assisted with distributing personal protective equipment in our Office of Emergency Management, and they've provided grant support to families in need in our Community Services Division. Moreover, we have 5 of the 20 COVID fellows supporting the administrative work of the YMCA, which of course has stepped up to provide both food and child care assistance to essential workers during this pandemic. Our program with the 20 summer fellows ends this week, and we will miss them, but as they return to college and return to the workforce, we're hopeful that they'll take a lot of lessons with them, lessons around how to properly wear a mask, how to promote social distance, and how to help slow the spread. We think these lessons are important for all, and hopefully they'll spread them to their friends and to their family members. I want to thank them for their hard work as our first kind of inaugural class of public health professionals, our COVID fellows. So thank you very much. At this time, I welcome to the podium Director Haushalter. Thanks.
Thank you, Mayor, and good afternoon, everyone. I want to thank everyone for their efforts to reduce the transmission of COVID in our community, particularly around masking. We're really looking forward to the University of Memphis students joining us, and they'll be able to share at that time data prior to the one city ordinance, but also the health directive, and then data afterwards to share with the community whether or not those particular policies have impacted our increased mask usage or not. I'm going to give a few brief updates on data as I always do, and then this afternoon Jenny Bartlett-Prescott has joined us. She's been with us before. She leads the community-based testing efforts and does coordination, so she's going to share some very specific things on testing. As of this morning, we have 16,978 cases. That's an increase of 211 since yesterday. But over the past week to week and a half, we've been averaging somewhere around 400 new cases per day. At the current time, that has been a steady average, which is reinforcing to us. It's a positive sign. We do want to get that number down, but at a minimum, we know that it's not increasing significantly if we look at daily averages by date of testing and date of reporting. Our R0 currently is at 1.12, which is a little bit lower than we reported a week or so ago, so that's a positive sign as well. And we're very pleased to announce that our deaths are remaining at 244, so that we have no new deaths to report from yesterday. We have received some clarifying questions recently that I think are worth addressing for the whole community. So one of the questions we've received is in the number of positives that we report, does that include anyone who's been tested more than once? And the answer is no. So that if an individual gets tested more than once, they're only counted in the system one time. So the number of over 16,000 represents the number of individual people within Shelby County who have been diagnosed positive. And then with a lot of focus on the newer testing that looks at serology to determine if someone had been infected or not, there were questions about whether that particular test result is in this 16,000 as well, and the answer there is no. So this 16,000 plus is those individuals who have tested positive on a PCR test or meet criteria for probable COVID, which is a very specific criteria, not a test that looks at whether or not someone may have been infected in the past. One of the key things that we've been focused on in public health is building the public health workforce. We were able to onboard a significant number of the new team last week. We will be onboarding some new individuals the beginning of August, and we'll be looking at expanding that team. So my hopes are that perhaps some of the fellows that spent their summer with us will be interested in a career in public health and potentially join us. I'm going to turn it over to Jenny Bartlett-Prescott. We want to talk a lot about testing today and then open it up for questions.
Thank you, Dr. Haushalter. Good afternoon. So as Dr. Haushalter said, my primary role with the Joint Task Force is in coordinating the many partners that are offering community test sites across Shelby County. So on behalf of that task force group, I have a few updates to offer. So we are experiencing limited access at our community test sites due to two primary reasons. The first, of course, is increased demand. We have more people seeking testing than we ever have before, and that, of course, produces increased volume trying to come through our sites. But the second thing that has been a more recent shift is the national shortage that we're seeing in test supplies and reagents for laboratories to use to process the tests have now hit our local community. And our own local labs that support our community test sites are limited in their ability to expand their services to address this increased volume of people coming in, and limited in their ability to process the amount of tests that are coming through their labs. And so that is why we're seeing delays in test results coming back. Our normal target is 48 hours, where we want to be able to give test results back to people receiving testing at our community sites. And many sites, that is expanded to 3 to 5 days, and some even longer than 5 days. But we are seeking and planning options to increase our testing ability around our community. There is good coordination, there is good communication among our local labs, the health department, our community testing partners, and the joint task force. And as we identify solutions, I can assure you we will quickly implement them and put them in place as fast as we can. So in the meantime, there's a few key points that we believe it's important for the public to understand while we work towards solutions to increase testing access. The first one is that our testing sites are following CDC recommendations. Now that we are seeing limited access to testing, we now need to prioritize who can be tested and how we schedule people in for tests to make sure the people who need it most get it first. So the first priority are going to be people with symptoms. Folks who are symptomatic, we're going to want to make sure we can try to get them in for testing. The second priority will then be people who have known contact with or close contact, which means you were within 6 feet, 6 feet for 15 minutes. It would be defined as a close contact of a known positive case of COVID. That will be our second priority to try to get in. That means that there is incredibly limited access for asymptomatic testing. People who are seeking testing and do not have any symptoms and do not have a known exposure are unlikely to be able to access a test at this point. We hope that will change as quickly as we can put solutions in place. In particular, we want to ask the employers of our community to please not require your employees to get tests in order to return to work. That is creating additional volume into our test sites, and it is also delaying people from being able to return to work when they're not able to access those tests. Please visit our website, covid19.memphistn.gov. That is where we are keeping the most recent information about the community test sites, where they're located, which ones are available, the access that you have to each of those sites, and we're trying to keep that information as current as we can. Understand that this is a changing environment and that information changes rapidly, but we're doing our best to really focus on that one website to stay as up to date as possible. I believe that's the end of our prepared statements, and so we want to open it up for questions at this point.
Omar Yusuf, Daily Memphian.
Hi, my first question is about the current issues regarding testing in labs. So what are some of those potential solutions that you all are looking at? And I do have a follow-up.
So I can speak at least to some that I'm aware of, and Dr. Haushalter, you may take a follow-up there. Among our partners that are doing community test sites, one thing that we're trying to implement is that we have multiple avenues for getting lab tests performed. Originally, each of our community sites had one primary lab that they were working with, and then we are looking at having multiple labs that we have interfaces for and that we have the processes in place, so if we need to pivot, we can. I do know behind the scenes the labs are working really well together, and as much as they can, if they can divert lab volume to a lab partner who has access, then they are putting those efforts in place as well. We are looking at possible higher volume sites where community test partners can work together to staff extended hours and extended access in order to create a more efficient process. And that's about all I know. I don't know if you have anything else. Okay.
Go ahead with your follow-up.
I was also wondering about an update about when we could expect to hear an announcement regarding the tripwires.
So in regards to tripwires, we have drafted those. They were shared with the elected officials last week. I will be having a meeting with Mayor Harris and the other mayors this afternoon to receive additional feedback, and then we'll be revising those for the public. And so ideally within the next week, you should be able to see those. I also just want to remind everyone that we can still move forward as needed or move backward as needed as informed by the data, regardless of whether those tripwires have been released or not. But we anticipate doing that very soon.
Brad Broders, Local 24.
Thanks. This goes to either Dr. Haushalter or the testing expert you just spoke. My first question is, how significant is this to have this limitations with testing in being able to properly contain the spread and get a real sense of the spread in the community? And I have a follow-up.
So we know any delays in accessing testing and accessing the results of those tests are significant. That's a nationwide problem. Here to date, we really haven't had as much of a challenge in Shelby County. Those who need tested have been able to access testing. However, if we prioritize, which Jenny noted, particularly by focusing on those who are symptomatic, we're still able to determine the amount of transmission that occurs in our community. That's just considered and part of the calculation.
Thank you. And as my follow-up, Dr. Haushalter, do you have any update on, as the health department is reviewing school reopening plans, any update of what you all are looking at and just kind of that process for parents out there?
That's a great question, and we're getting a lot of questions, not just from the schools, but also parents want to know the things they need to consider in making a decision about returning their children to school or pursuing alternate options. We're really looking to see that the schools have utilized the 2 national guidance documents. So one of those is by the CDC, and the other is by the American Academy of Pediatrics. There's a lot of similarities, but there are some differences there, but that they've utilized that guidance to tailor their plan for their specific school, their specific school district, and the children and families that they serve. But one of the key things we'll look at is flexibility. We do know, and again, this is not just limited to Shelby County, there's ongoing transmission in many communities across this country, so schools have to be flexible in their ability to make adjustments to, one, meet the needs of the students, but also to reduce transmission within their school settings.
Shay Arthur, WREG.
Hi there, hope you guys are having a good day. Miss Bartlett-Prescott kind of touched on this a little bit there about asking employers not to ask for that follow-up test, but what's your message to people who are at home waiting for these results? You know, they're waiting 10 days, 2 weeks. Should they just go back to work if their symptoms are gone? Or, you know, there's a lot of people dealing with this right now. What do you say to them?
So, I mean, there are recommendations in place for 2 different instances. So the one instance that you just covered right there is someone who was symptomatic and is seeking testing as we would recommend and staying isolated at home and not returning to work until we know the results of those tests. And so we're going to follow the recommendations of the CDC with that, meaning that once you are 10 days past the onset of your symptoms and you're at least 3 days without symptoms, then you are considered free from isolation. And I'll let Dr. Haushalter correct me if I get any of that wrong. And so that is called a symptom-based release from isolation instead of a test-based release from isolation. And that is what we are recommending at this time. Particularly what we were speaking to earlier with the employer recommendations is some employers are requiring people who are asymptomatic, have not sought COVID testing at all, to get a COVID test that shows negative in order to return to work. And so we need both of those situations where we're not requiring an employee to just get a COVID test to work, period, or we're not requiring an employee that once they've cleared the isolation guidelines as directed by our health department and as directed by the CDC, that we can use the symptom-based clearance from isolation instead of test-based clearance from isolation.
Thank you. And is there a specific number? I don't know, just to say how far behind testing is or how backed up things are?
I don't know if there's a specific number. I will say that what we look at is our capacity at all of our community test sites. Now, keep in mind that there are other commercial-based test sites like the pharmacies, the Walgreens, the CVS, the minor medical centers, and Baptist, pop-up testing sites that we don't have full access to their data and their capacity. Anecdotally, we believe all sites are experiencing the same issue where the volume of people seeking to get tested is more than the capacity of tests we have to offer. So all test sites that we at least know the data on are at somewhere between 90 to 100% capacity.
Kendall Downing, WMC.
Hey everyone. First question is for Director Haushalter. I know that obviously you may have seen some of the pictures that circulated over the weekend about Beale Street and some of the crowds there as the establishments closed. I was wondering what the status is of the health department's potential enforcement. I know the mayor last week had referenced that you all had gotten complaints from Beale Street and were looking at Beale Street, and I have a follow-up.
So we are exploring the options, really not limited to Beale Street, but clearly Beale Street has been brought to the forefront over the last week or week and a half, and we will be having some further discussion today and tomorrow morning about the best actions to take. I will remind everyone that if people mask up and they wear their mask in public, and if they adhere to social distancing, particularly in restaurants, that means it's less likely that we have to take action that's going to restrict businesses. So there's been a common goal to, one, get children back to school, but the other to get people back to work. But it is going to take all of us to do what we can to reduce transmission, and wearing masks is a critical piece of that. We do know that the data from Beale Street specifically relative to the University of Memphis and their observational studies, use of masks has increased, but it's still not exactly where we need it to be. And your follow-up question, please?
Yes, it's about lab capacity. I know that UT obviously has capacity at their lab. How effectively is that being utilized? And you all kind of touched on it. Is it possible to move some community testing specimens over to the UT lab if they're not necessarily collected at the UT sites? Thank you.
So UT has been a partner in this effort from the very beginning, not just for testing, but also in sharing their medical expertise as well as their biostatisticians' expertise as well. And yes, we're looking at opportunities at UT specifically, and also how UT might even further expand their testing capacity within their lab.
Sam Hardiman, Commercial Appeal.
Hi, can you hear me?
Yes.
Sir.
Yes, sorry. So I have a question about hospital capacity. Since the health department started releasing the HRTS data, the amount of available the total amount of ICU beds available in Memphis has declined since earlier in the pandemic. It used to be about 480, and now it's running about 440. Where did those 40 or so beds go? And then I have a follow-up.
So those beds, obviously, if they're not being utilized for COVID patients, may be utilized elsewhere, but also sometimes what will happen in a facility, they may flex their beds from one capacity to another, and then also their ability to report also has to do with staffing. So there's a combination of things that influence total bed capacity, and then based on the needs of the hospital and their patients, they may use some of those beds for an alternative purpose. And your follow-up, please?
And my follow-up is, how much hospital surge capacity is either being activated or been activated or in the process of being activated, given how close we have come to bumping up against the limits of what ICUs in particular can handle?
So a couple things, and it's not necessarily a real detailed answer to your question. There is a surge committee that meets regularly throughout the week, and they are always looking at what are the triggers that would cause them to take action as a collective group, but also each hospital has their own internal triggers for building their surge capacity. Simultaneously, the state health department has their, I'll say, preliminary criteria in place for opening the alternate care site. We know that we have plenty of bed capacity there, and that is all being explored. One of the things that we've not talked about in a while, but I want to go ahead and mention because it's related to your question, we've also partnered closely with the West Tennessee Regional Forensic Center. That is an organization that reports up through the health department and the county already, but we have also put an agreement in place for expanded morgue capacity in the event that we would need that as well. So plans for surge have continued and not abated throughout this pandemic.
Katie Reardon, WKNO.
Hey there, I apologize if things have already been asked because my feed's been going in and out, but I was wondering if I could get the exact number of what testing capacity is at right now, and then if you're confident that that is enough capacity to test everyone who is either symptomatic or has been exposed. And then my second question was how much of an issue the supply chain is for testing. So for like UTHSC, for example, is it talking about them possibly scaling up more tests? Is the more limiting factor that they wouldn't have the supplies to process those tests?
So I'll start with the second question and turn it over to Jenny so she can respond to the first question. Concerns about reagent are a nationwide problem, and they can impact local labs as well. With some labs, they have the ability to produce some of their own supplies internally, and all of those things are being explored. The one thing that I think has been a consistent theme from the very beginning of this pandemic is we have had to come up with local solutions. We have been one of the counties that have been leading across the state because we had early cases, very similar to Nashville, Davidson County. And so I'm very confident in our partnership and our ability to come together and access local resources and garner state and national resources. So while we know there's a supply chain issue, I know that we are working very diligently to address that and bring every possibility to bear so that we can solve that problem. And then I'll turn it over to Jenny.
So as I mentioned before, we are able to calculate capacity for about 2/3 of the testing access that we're aware of. Our community sites that are built upon safety net clinics are about 1/3 of our capacity. Then we have commercial partners like Walgreens and CVS, which are about another 1/3. And then the Baptist Emergency Department kind of pop-up based testing is about another 1/3 as well. So if I were to calculate on the 2/3 that we know about, we think that we have around 7,000 tests a week that are available. We know that the Baptist system would add on top of that. With whether that's enough or not, you know, the indication is really just how full our test sites are. So since our test sites are at 90 to 100% across the board, that's an indication that it is not enough. We will see as we continue to prioritize and really make sure we're getting our symptomatic individuals in, whether we see some of that capacity lighten up. But that is why we are focused fully on increasing test expansion capacity, both for our labs and our test sites.
Jacob Steimer, Memphis Business Journal. Jacob Steimer.
Dr. Haushalter, can you hear me?
Yes, we can hear you.
Okay, Dr. Haushalter, last week you said the average turnaround for tests was about 5 to 7 days. Is that still a good number for us to work off of, or is it extended?
That's still about what it is. But there's also a wide variability, and Jenny alluded to that earlier. Some sites are turning them around a little bit sooner, but any day that we report out, we're getting test results sometimes from 15 to 17 days. So that's a lot of variability in the system, including a longer average time for reporting out.
And then the positivity rate continues to climb. To what degree does that represent, increased cases, true cases in the community, even though the confirmed positive cases have somewhat leveled?
So the positivity rate is an indication that we still continue to have ongoing community transmission. Again, keep in mind at the beginning of the pandemic, we know that our cases were related to travel. Then we saw transmission in households and in work environments, and now we see more broader transmission, and that particular positivity rate is reflective of that. And when I say broader transmission, it is with social interaction that's outside one's household or workplace. And so we need to be alarmed by the 15% or greater positivity rate. We ideally want that at 10 or below 10.
We are out of time. Are there any final messages?
I just want to remind everybody of the importance of voting. We had Linda Phillips here talk through all the things that were in place to assure that the voting environment was a safe one, so please exercise your right to vote.
Thanks, everyone. We'll see you Thursday.